Hi, Christian Bates here. I'm one of the osteopaths at the Paramount Clinic, and I'm also the naturopath here. This is one of the videos adding to the series of osteoarthritis videos that we have on here. And I wanted to add in today an interesting aspect to this, which is, can your gut and your digestion play a role in the pain that you have in your joints? And it can, because poor gut and digestion can create an inflammatory process, and that inflammatory process could get lodged in your joints, and it would particularly pick on a weaker joint. So if you did have, say, an osteoarthritic joint, and naturally that joint is a bit weaker and has inflammation going on in it, then the poor digestion of trigger foods might decide to go to that joint more than a healthier one. So how does this work? It's known that some food particles can kind of even look similar to other parts of our bodies. So if that food and you have an allergic response to that food in your bloodstream, then you create the inflammation. So that inflammation is now circulating and then might hit you in your painful joint that you already have. So the aim of this video is to get across to you that gut issues could be linked to a joint pain that you have. They can be linked to pain and other issues in general, pain and inflammation. But if you do suffer the gut and a joint problem, it's often, very, very often, worth looking at your gut. So you can have digestion of food. You want the correct digestion. Once that food's digested, it goes through to the small intestine to be absorbed into the bloodstream. If you don't have correct digestion, so if your stomach acid is weak, then those food particles are thought to be able to get through into your bloodstream in kind of bigger. Say this is nicely broken down. They might be larger like this, and the body starts an inflammatory reaction to this, which then could spill over into your joint, for example. So you could have incorrect digestion. So we can help that. You might also have your small intestine have something that we call like a leaky gut, where there might be small intestine damage, and instead of the walls of the intestines being nice and tight like this and selectively allowing particles of food out, they're like this. So you have a bit of damage, and then things kind of, picture it, that they seep through into your bloodstream. Your body attacks it because it doesn't know what they are, and again that creates the inflammation that could then go to your joint. So to summarize the whole point of this video, if you have inflammation or pain, for example in this series osteoarthritis, and you have a digestion problem, reflux, absorption, wind, these kind of things, you might want to look at helping your gut, and that could really actually help your joints as well, the joint inflammation. So you can also look at food intolerance testing, these type of things as well. So there's actually plenty you can do to help your digestion. Leave comments, ask questions, and I'll ask any of the professionals at the Paramount Clinic, and we can get back to you and give you a hand. Thanks.